Heidi Clopton, pediatric occupational therapist, and this is called the Moro Reflex Integration Exercise. So when you are first born, you have primitive reflexes as infants, and they're there to help you gain motor skills. But sometimes children hold on to these reflexes and they're not what we call integrated, so it can cause difficulties. So the Moro reflex is one that I see in the clinic a lot with children that is not integrated yet. So signs of Moro reflex that it's not integrated is jumping to sudden sights or sounds, being afraid of unpredictable environments like crowds, or not liking loud noises or sudden sounds. And so this activity is really good to help with that. So what we're teaching the brain is that there is a space behind you, and how to be aware of that space and to feel free to move into that space. Instead of feeling like your world is here, we're trying to expand the brain's awareness of the space behind them. So this helps to integrate that reflex. So when you're an infant and you have that reflex and there's a sudden sound, or your neck changes position, like you lay a baby down to change their diaper and they reach out to grab for you, or their arms go up in space and they have a sudden change in muscle tone, then that's a sign of a Moro reflex. Up until about 6 months, it's normal, but when children have symptoms of that later on, fear of falling, gravitational insecurity, fear of changes in movement, or fear of changes in sounds or environments, then there's ways to get rid of that and help them get past that. So the first activity we're going to do is we're just going to lay back. So let your head go back, let your arms go back in the space behind you, and feel that there's a space behind you, okay? So sometimes this is called the starfish. So we're coming out, and then let's come up, Jace. So sit up, and we're going to go back. So this is flexion, so we're back in flexion with the neck, and the arms can come up into flexion right here, okay? And then now we're going to go back into what we call extension in therapy. So we're going to extend back, okay? Come back up, Jace, into flexion, okay? Tuck your chin, good. And then go back on your own. I'm just here to help if he wants to try and fall. There we go. And come back up. So let's do that 10 times as fast as we can, okay? Ready, set, go. And he's on a therapy ball, so he's up off the ground. All right, that's good. All right, so another way, if the child is not old enough to want to comply to sit-ups basically over a ball, then there's some fun ways to do this. So one fun way is for little girls. You can have beaded necklaces that they can grab behind them and then put on when they sit up. Or for boys, they like things that are crazy looking. So for Jace, we've got this crazy looking thing. So look what's behind you. That's okay. There we go. So I'm always here to help in case they fall. There you go. So reach for something and then bring it up. You could even have a target to throw it to and have a whole bucket of activities back here that they could reach behind, sit up, and then throw. All right, so go back and give it back to Miss Samantha. Good job. Good. All right. So that's Moro integration activity.